Hi, Emily. Welcome to the show. I'm very excited to have you on today.
Hi, thanks for having me.
So, today we're going to focus on connecting developmental therapy and early life experiences. And so, I'd love for you to just start off with talking to the audience a little bit about who you are and how you got into this path of really combining the two together.
Sure. So I am a neuro-developmental delay therapist, and I am also a midwife's assistant, and I've been doing both for just over a decade. Um, on the therapy side of things, what I do is look at the way a lot of early brain and body pieces are developing. So things that happen during pregnancy, during birth, during early infancy. I'm looking at things like how the stress response works. I'm looking at early primitive reflexes. I'm looking at the vestibular system, things like visual motor skills, so how well kids can move and coordinate their eyes. All of these early pieces that are developing during, pre-infancy stage, or basically through infancy. And all of these pieces provide the foundation on which the rest of the brain develops and functions. So when there's problems with these early pieces, it spills into a lot of other areas. So things like emotion regulation, social awareness, academic performance, all of the things that parents tend to care about later on when kids are older. And they don't necessarily realize that they can be traced back to things that were happening during those early stages and how important that early time period is.
hmm And this is specifically pregnancy through about a year old. Is that what you're talking about?
Yeah, about a year old. So one of the main things that I'm looking at are early reflexes. So babies are born with a set of reflexes that they keep for about the first year or so. They all kind of integrate at different times. So there's a spectrum within that first year, but they're mostly present during that time period when babies don't have very much control over their bodies. So we're born pretty immature, and babies really rely on these kind of ingrained reflexes and movement patterns in order to survive and function. They don't really have a lot of control over their own body and their own movements. A lot of pretty much everything that they do when they're first born is really reflexive. And then as they develop and their brain gets more control, it lets go of these early reflexes and these kind of more ingrained patterns, and they start to have more conscious control over their body. And that's a big thing that's happening during the first year. Is basically a big part of brain development is babies are figuring out how to move and use their body and figuring out how to interact with and engage with the world. So that's mostly what's happening during that first year. But there's a lot of things that can disrupt that development. And so what you wind up with is older kids that still have a lot of these really immature patterns and immature connections. And then you can see kind of a negative domino effect into the way the rest of their brain works and develops.
hmm
Probably the most obvious thing that I see with this has to do with the way our stress response develops. So babies have a very sensitive startle reflex, and they have a very sensitive stress response, basically. So it's really easy to startle them. They tend to have a big physiological reaction. And then as they develop, that one should start to disappear. And we develop a much more mature and advanced response to our environment. So it's harder to startle us. We have connections to different parts of our brain that help us to evaluate a situation and have more complex and more dynamic responses. So we just interact with the world in a much more mature way. But a lot of the kids that I see, that piece didn't develop properly. So they still have this kind of hypersensitive, hyperactive stress response that you typically see in newborns. And that can create lots and lots of secondary problems as they get older. It impacts the way all of their emotion regulation develops, it impacts social skills. It really can impact attention and arousal and the way that whole circuit in our brain functions. And then you can also see physical things that come with that. When kids are in kind of a heightened stress response for too much of their life, then it affects their immune system. It affects their gut, a lot of physical things too. So that's kind of one example of a lot of different areas that I'm looking for.
Oh, yeah. I mean, this is like such important work because I feel like this is there's more and more children having developmental delays. And I know I've done a previous podcast about how the CDC had moved some of those early milestones and making them later to help the bell curve, which I strongly disagree with. I'm curious what your thoughts are around that.
Yeah, definitely disagree with that too. I think that the the difference between common and normal or optimal, those are two very different things. And just because abnormal is becoming common does not
Mm.
mean that we should change our standard of what we expect or want for our children. And that's just
100%. It's really true. It's like trying to normalize delays, and that's just not okay, right? We really want to, I think, identify the causes, the root causes of why these delays are happening, why they're happening more frequently, why it's becoming more common and average, and then what we can do to reverse that. So I would love to hear some of your thoughts around that.
yeah, absolutely. So there's a lot of things that I think go into it. I don't think it's one thing, but early development, I think, is super important. So, what's happening during pregnancy is really important because babies are learning, their brains and bodies are learning how to function during that time. And the way that we are designed to do that is we develop based on what we experience. So, as babies are developing in the womb, moms, stress goes up and down, blood sugar goes up and down, all of these things that are happening, babies getting kind of a microdose of that. And that's teaching their brain and body how to function so that when they're on the outside, they can start to do that on their own. So when we've got moms that experience a lot of chronic stress, when we've got moms that are struggling and not healthy and that are having their nutrient deprived and all of the things that go into pregnancy, then you've got babies that are learning that that's normal. That's what
Mm.
their body is learning. That's the environment that they're being born into. So they're going to adapt the way mom does. So things that we experience during pregnancy really set our babies up for how they're going to function after. And then the birth process is actually super important and really kind of an overlooked stage for most of us. Um, because what's happening is babies are going from being a fetus to being a newborn. And there's a huge transition that happens during that time. Their bodies have to begin taking over and doing so many things that mom does during pregnancy. And they use a lot of different reflexes and a lot of different body systems during birth that help with that process. And the process of a normal labor, meaning like mom goes into labor, it's not interrupted with any interventions or medications, really helps to prime baby's nervous system to function on its own outside of the womb. So it's doing things like raising their cortisol levels, which sounds bad, but it's actually really important for babies. It's stimulating and strengthening all of these early survival reflexes. And then they're born and they start to take that over and they transition on their own. And that process is super complex, even though we don't think about it being very complex, because for the most part, babies do it great on their own. So we kind of forget that this is a huge experience for them.
And the fact, I think I just want to back up a little bit here. Babies are active in the birthing process. I think a lot of people just think, with a vaginal delivery, mom's pushing that baby out and she's doing
Yes.
all of the work. But it is a team approach. Baby is working their way down the birth canal. Mom's uterus and pelvic floor muscles are working together to deliver that baby safely. And so I think what I'm hearing from you, if the labor is induced, and the baby's maybe not ready to be born, that could be a potential challenge. Or interventions to help speed things along, like Pitocin during the labor, that can cause up to 50 times stronger uterine contractions, can interfere with the baby's reflexes and passage through the canal, right? So all of these interventions are going to impact that birth. And then if it's a cesarean, that also the baby never got to do its thing, right? It never got to
Hmm.
move its little body down the canal. It just was, whipped out. So yeah, all of these things are important for pregnant moms to be aware of when they're choosing birth and deciding the kind of birth they want to have.
That's right. And a lot of people just kind of skip over birth in the developmental field, at least. We just don't consider that. But when they were researching to see like what are the main risk factors that we look for that are going to indicate that a child is more likely to have these specific types of early developmental delays. And it was the birth practice was the number one risk factors that we look at. So things like cesarean, induction, vacuum or forceps delivery,
Mm.
trauma, any sort of like trauma around that birth process was the number one risk factor for whether or not kids would have retained reflexes and these early developmental things that we're looking at, which I think surprised actually the people that were doing that research. They expected pregnancy to be more important and early infancy, which they are. They're all really important, but birth was a lot more important than I think anybody really expected. And I think it is because of that thing right there, that babies are active participants and birth is kind of this incredible one-time event that really helps to prime our brain and our body to be functional little humans in the outside world.
Yeah,
And
I mean, even if you think about that baby going through the birth canal, their cranial bones are overlapping. This is directly impacting their nervous system in a good way, right? There's that, and then I'm thinking about the babies that are delivered with a vacuum. I don't really see forceps, but any type of, pulling or force to deliver that baby is going to do the opposite with that
Mhm.
brain support essentially. And as a craniopath, I'm just so aware about when the head doesn't go through that normal overlap and also then maybe has trauma on it, then it's going to impact the brain function, right? And we have to do work to help heal and correct that with cranial work.
Yeah, and it's not just that, it's that afterwards, if you have a vacuum or forcep delivery, something like that, and you've got neck tension or injuries or problems with the way that they move, that's going to impact the way that they move. It's going to impact all of
Development.
those reflexes.
Oh yeah.
And so you have babies that aren't using their body fully because they're essentially injured. And
Right.
that is really going to impact the way that their brain and bodies develop because, especially early on, most of brain development happens based on how we move and how we interact with our environment. So that's a really key factor in how our brain develops and how it functions is basically how we move and use our body
Yeah.
and the way we engage with the world. So these poor little babies don't get the same type of full experience, and that is going to impact the way their brain functions.
Right. I mean, that's why I'm such a proponent for babies getting chiropractic care as soon as possible after birth because we're able to do a wellness checkup and not wait for these delays and developmental
Mhm.
challenges to show up down the road. We can correct them pretty quickly and very safely by doing this work on a tiny, tiny, fresh out of the womb baby, where we get more bang for the buck, so to speak, as opposed to what I've seen in my practice. If this baby who had a birth trauma now shows up for the first visit at 3 months, which people are like, 3 months, it's still a tiny baby. But that's a pattern now that's been in that baby for
Mm.
3 months versus, let's say, 3 days. And there's a lot more work to be done with that older baby. And I'm sure you see the same. The longer from your trauma, the longer you've had that injury, the more work is needed to repair it.
Yeah, absolutely. And I'm usually seeing it at like 6 years, not 3 months, which is a
Oh
lot longer.
man, that's even a lot longer.
Yes. Uh,
So if
but
you have a child who's now 6 years old, maybe this child skipped crawling, right? That's definitely one of the issues that we see, and they're not getting that cross crawl um, corpus callosum development to help their right and left hemispheres communicate. This child might have, what will you see with this child
well, it really depends. But the first thing that I'm looking at is going to be early reflexes.
in
So
this
before
6 year
we
old, right?
Yes, before
Okay.
we even get to crawling. So crawling and the like left right sides are actually like pretty far into development as far as I'm concerned and looking
Right.
at. So I always want to look at the earliest possible piece and work up from there. So I'm looking at these early reflexes like that early startle reflex. There's one called the asymmetrical tonic neck reflex where when kids turn their head to either side, you'll see extension in the side of the body that they're looking at and flexion in the opposite side. And so I'm looking at things like that because those affect the way we coordinate our left and right sides. Those affect the way our head and body body coordinate. So that impacts things like posture. It impacts visual skills. So how well we can track and how well our eyes move.
Mm.
It affects the way our the left and right sides of our brain communicate. And all of these things impact things like memory and reading and writing and cognitive function. So any of those pieces that are not working well can really negatively impact school. And that's typically what parents care about. You know, they're coming in to me because they're concerned about reading or writing or academic performance, not necessarily because they're concerned about posture or these reflexes.
I'm
But
concerned about posture.
yes, I'm sure you are.
But yeah,
Um,
I hear you. I mean, and this is all connected, right? It's essentially a nervous system that's not thriving, right?
that's
So
right.
you're the investigator, you're looking at this child from an angle of reflexes and nervous system development, recognizing for whatever reason, well, not whatever reason, there are reasons why this child did not integrate those primitive reflexes in the first year of their life. And now they're school age. So if this child still has these retained reflexes, how do you help them integrate them so that they can essentially move on to the next developmental stage?
Yeah, we do it's basically just like, it's almost like a physical therapy type program. It's probably the best way to look at it. I have very specific exercises that kids do that target different reflexes and different body systems, like the vestibular and visual system. And it's mostly done at home. So actually, I teach parents how to do it, and then they go home and they do it with their kids. And the best way that I have found is to do small amounts daily. So typically, we do maybe 7 to 15 minutes of work every day, and because the consistency is really important,
Mm,
especially if you are working with a child who has a retained startle reflex and a really hypersensitive nervous system. You want to do little bits consistently, because trying to do too much can be really overwhelming and
mm,
can have the opposite effect. If you've got a nervous system that is very much in survival mode, you don't want to overload it with too much at a time. So we
yeah.
do small amounts consistently and are always kind of constantly checking back to make sure, are we seeing progress? Is this child tolerating it? But it's all mostly done at home. So I teach parents how to do these exercises. They work with their kids, and then we just stay in contact during that time.
So you can work with families living anywhere. Can you do the consult virtually and then give the the protocol and individualized protocol to that family?
Yes, so
Okay.
I can do it remotely. If
Yes.
they're in Colorado, then I have them come to the office for at least the first visit,
Yep.
just because it's less work for me.
Hmm.
I like seeing them in person if I can,
Of
but
course.
definitely we can do stuff remote. And then I have like a list of people that also do this. So if there's somebody that's local to you and you want to go in person, I'll try to get you connected.
Mm,
But there's not a ton of us in the U.S., so
yeah. It's such a niche, but I can see why it's so needed. And this is really, I feel like this would really address and resolve these children's challenges, these school age children's challenges so much faster than a traditional OTPT program that's maybe teaching them skills or coping strategies, but not addressing the nervous system component. And so I feel like that is just really the best place to start. And then do they still have other therapies that they might still co-treat with?
yeah, definitely. Depending on the child, we might add in a lot of different things. I'm a huge fan of attachment theory and attachment things. I'm a big fan of getting like breathing, sleep, airway stuff working.
Oh, yeah.
Big fan of like nutrition and body work, chiropractic, craniosacral, all of the things that help the body to work well.
Yeah.
So I'm always trying to work with families to develop a plan that works for them. And like I mentioned before, you have to be careful when you're doing therapeutic interventions, because more is not necessarily always better. We want to start early, start gentle, and work with whatever that child's body is telling us it needs and whatever they're responding to. So sometimes that involves multiple therapies, sometimes it involves like one or two at a time.
Mhm.
But that's always my goal, is to try to build as much of a team as we can to really support this child from all angles.
Yeah, that makes so much sense. So, as a parent's listening to this, how would they know that this therapy would be helpful for their child?
Sure. Well, the main thing I would start with would be if they're having any concerning symptoms. The first area that we'd look at would be emotional regulation. So, a lot of anxiety, a lot of emotional immaturity, kids that tend to be like really angry or fall into more of that fight category, but just these kids that cannot seem to regulate, even if you're calm and regulated too. The kids that seem really just emotionally sensitive. Also, socially, kids that struggle with communication, with social interactions, with recognizing social cues or communicating their needs, and then academics as well. So, if kids are behind with reading, writing, anything in the learning spectrum, I always want to check and look and see. Learning is a very high level, complex brain pattern. And so, usually, there's a lot of other things that went awry first before we get to that piece. So, anything in that realm, we would want to look and see. And I offer free screenings for families. So I have a whole questionnaire that
Oh,
asks questions from early pregnancy through present day that look at a lot of these risk factors, that look at these symptoms. And I always offer families free consults to go through that and see, like, does it seem like they are likely to have these types of early developmental issues, or should we focus somewhere else first? So that's always an option, but
mm,
it's very individual.
right. And what are the age of the children that you're working with?
Pretty much 3 and up. So I will work with adults if they are living at home still or they
Mm,
have family support. It's very hard to do this type of therapy as a single individual adult by yourself. It really has to be adapted because a lot of the exercises and things require a parent or somebody else to help. So I try to avoid working with adults if I can.
right. Unless it's somebody who is, do you have children that are severely disabled that benefit from this type of work?
I have a few that I have taken. Usually they're siblings of other kids that I'm working with, so I know
Uh,
the family. So I will work with some more severe kids in very special circumstances. But again, things have to be really adapted. And so a lot of times there's other services that would be better, but I'm
right.
always happy to discuss that with families.
Right. And so I'd love for you to share maybe a success story that you've had in your practice with a specific child and kind of walk us through like what their treatment plan looked like and the outcome.
Sure. Let me think about that. Okay. So I had a girl that I was working with. She was one of my more like extreme anxiety cases. I met her mom at a homeschool conference actually, and she came up to me. I had a little checklist that just included like a lot of symptoms. So things in the emotional category, the learning category, all of that. And this mom came up to me crying and just handed me the list with like everything checked off. And her
Mm,
daughter was bawling and clinging to her leg. We couldn't even really talk then. And so scheduled an appointment, had her come in, and she was just this girl was terrified of everything. She like really couldn't make eye contact with me, would get really stiff and panicky if I got close. She couldn't close her eyes without just completely startling. She's pretty significant, like extreme fear response to everything. I had to really adapt to the assessment. I couldn't touch her, I couldn't get too close. I had to have mom in between us the whole time.
how
And
old is this
so
child?
she was, I want to say 7 or 8 at the time.
Oh,
She's
wow.
a little bit older. So really extreme for somebody her age to be that emotionally dysregulated.
Mm,
So we started working with her and just really started with the stress response, nothing else. Started really gentle. She just did a couple of minutes of work every day, and she really just started to open up and like that anxiety started to melt away. By the time we were done, she would come in smiling and talking and making eye contact. And she started talking to people out in the world, would order food when she was at a restaurant. And then after a while of that settling down, then her academics started to come in, and she was really, really brilliant. She just was quite kind of constrained by a lot of her fears and anxieties. So she struggled a lot in school. But as soon as that lightened up, all of a sudden her reading and writing started to come in, and she loved science. She brought me in a chemistry textbook one time and was like reading her chemistry textbook when she was like 9 or 10 years old. And it was really beautiful to watch her kind of go from just completely dysfunctional to thriving.
That is amazing, and how heartwarming for that family, right?
Yeah.
Because everybody benefits. That mother was in tears, right,
Yes.
along with her daughter. So, and I think you also made a point earlier that I want to bring up again, because I've done a lot of podcasts about how children and babies co-regulate their nervous system with us, right, as the primary caregivers, moms especially. And but you mentioned, even if that parent is regulated and grounded and calm, the child can still be unregulated. And I think
Hmm.
that's a point I'd love for you to just go talk a little bit more about, if possible, because that makes sense to me. And it's also like this parent is so aware of how important it is for them to do the self-care and the work, because and then they're not getting the response that they're looking for, right?
Yes.
That's frustrating.
Oh, it's so hard. Yes. So regulation is a skill that develops, and babies, newborns, don't have it at all. So, as a newborn, we are completely dependent on somebody else to co regulate with us. But then, as we age, so within the first few years, that begins to change, and we start to be able to regulate ourselves. We still always keep both skills, even as adults. There's a lot of times when we need and want to co-regulate with somebody else, and you like have a connection that helps us to calm down and regulate, but we should have the ability to kind of do it on our own.
Mm,
And this is something that is developing during toddlerhood and early childhood, is usually when you start to see that come in more. But newborns cannot.
mm,
And a lot of the older kids that I see that still have that infant moro, so that hyperactive stress response, really struggle to develop skills that are not co-regulation, and even really struggle with co-regulation. And so what you have is these big intense emotions and reactions, and mom may be calm, but they still have to work through those. Physiologically, they just have such a big stress response that should be reserved for that early infancy period that is now happening at 5, 6, 7 years old.
mm,
And so it's not like you being calm and regulated immediately fixes that problem. They have to
mm.
still go through that whole process. They still have to wear out that physiology. And eventually it's going to happen again and again, because their nervous system is so reactive and sensitive that it's just a lot easier than it should be to put them into that stress response. And their stress cup is just so full all of the time that it's so easy to tip them over. And so they just have to experience it and go through it. So staying calm and regulated will help prevent escalation, but it's not going to fix the problem that is, I have a super sensitive, dysregulated nervous system that is overreacting to the world.
Right. Yeah, that makes a lot of sense. So we spent a lot of time talking about how the type of birth that a baby has impacts their ability to develop, or not. And I'd love for you to cover a little bit about things that can happen during pregnancy, and that early infancy that you mentioned also can really impact whether or not that baby is able to go through an optimal developmental stage.
Sure. So with pregnancy, a lot of the risk factors are risk factors for mom. So things like a lot of sustained chronic stress. And it's not that I want to be careful with when we talk about stress in pregnancy, because a lot of people just think stress in pregnancy is always bad. But what we want for pregnancy is that we can experience stress and then we can calm down and regulate. So there's a lot of positives to stress. Like exercise is a positive form of stress, and then we have good recovery. And so that process of up and down is really important and great for babies. But when we have moms that are chronically stressed, they are experiencing like low levels of chronic stress without that peak in recovery, that we know that in particular changes the way a baby's nervous system reacts to stress after birth. You can see that in like brain imaging studies for years down the road. So that's a big risk factor. Same thing with any type of illness or injury or complications, so medical problems, and then any type of drug or toxin exposure. So, obviously, like any illicit drugs, but also certain prescription medications and things can alter the nervous system and the way it works. And then a lot of toxic or toxin exposures.
Mm,
So, and the concerning thing and the hard thing with that is that, especially in the US, we live in a really toxic environment. I know that they recently did a study where they looked at infant cord blood and they found over 200 known toxins in infant cord blood.
right.
So we know that that is impacting babies in some way. So
Hmm.
even if it's a small amount, it just kind of can negatively impact their resiliency and their ability to adapt to other stressors and things that are going on. So I think that's also kind of a big factor here, especially in the US.
Yes.
Um, but those are big things that are happening during pregnancy. Obviously, any like major injuries, any abuse, domestic abuse is a lot of something I see a lot of. Anything moms experiencing, babies are experiencing
Right.
to
Emotional
an
trauma.
extent too. Exactly. Exactly. And then in early infancy, the big things that we're looking at are going to be things like skipping motor stages. So you mentioned crawling. Crawling is really important. A lot of people think it doesn't matter. We just want to get to walking, but
No,
the
don't skip
process,
it. Don't skip
exactly.
it.
The process of crawling helps to develop the eyes. It helps to develop the left and right sides of the body. It helps to make so many brain connections. Um, so crawling is a big one, but really like things like restricted movement. So I work with a lot of adopted children who were in group homes or orphanages where they were just understimulated in a lot of ways. They were
Right.
left to like sit in cots for a long time. They didn't get a lot of movement. They didn't get a lot of sensory input. They didn't get a lot of relational input, a lot of
Mm,
connection with people. Those are all major risk factors and things that we're looking at.
mm.
Um,
Makes
but
sense.
even if it's not extreme, babies that spend a lot of time confined to chairs and seats and bouncers and things where they're not getting a lot of movement. That's different if you're wearing babies. They get a lot more interaction with the environment. They get a lot more movement. They get a lot of time on the floor where they can move and start to kind of engage with the world that way. Those are all really important
Yes.
pieces.
Yeah. Yeah, I 100%. That's a big thing that comes up sometimes in my office is the second baby, the parents are afraid to give them that time on the floor because the older toddler is
Hmm.
messing around or there's a dog or whatever. And that baby's in a contraption, especially to me, the worst is the car seat when the baby's not in a car, a moving car, right?
Hmm.
We don't want to keep our babies in that. We don't want to keep them in a crib like a snoo that constrains them and doesn't allow that normal movement, right? Because that will delay things integrating like the startle reflex, right? If they're swaddled too long, right? Things like that can impact that baby's ability to start to integrate through physically moving their body.
That's right.
Yeah, awesome. Well, Emily, I could talk for hours about this with you because we both are very passionate about nervous systems and especially birth and infant development, right? So all of this is connected. I think that's the bottom line. Do you have any last thoughts that you want to share with the audience?
I mean, I think that the main takeaway that I always want families to understand is that it just because negative things happened does not mean that it's over. Our brains and bodies are so resilient, and
Mm,
we really have the ability to heal and adapt at any stage, even if we've experienced a lot of negative things. So, just like traumatic negative experiences can negatively impact the brain, positive ones can too. So, I don't want families to leave hearing something like this and be really discouraged that we're just all screwed because
yeah.
in reality, we have a lot of hope.
I was going to say, I feel like this is a very hopeful conversation, and really recognizing that there are tools like what you offer that can be integrated with children, even older children, that can make massive changes in their brain. I mean, the brain is still developing up until 25, right? So there's a
Mhm.
lot that can be done with these very small little steps and exercises that you're mentioning. So I think this is great. And I think it gives parents a lot of hope and how they can help support their child. So thank you so much for coming on the show today.
Thank you for having me.
Well, I hope you enjoyed today's show and definitely make sure to visit Emily's website at earlyrootstherapy.com, or you can check her out on Instagram or Facebook at Early Roots. Additionally, if you need extra support and guidance with your own personal health journey, I am here to help. As an IFM trained functional medicine practitioner with over 20 years of experience, I am now offering virtual functional medicine consultations, specializing in preconception, fertility, and women's health. Please go to my website at drlaurabrayton.com, drlaurabrayton.com, and click Become a Patient to schedule a complimentary 15-minute discovery call with me to see if my program is the right fit for you. Also, if you love this show, please leave us a review. Go to ratethispodcast.com/well-adjusted mama and follow the simple instructions.